says we're good.
Just the light is off. It's mixed up today.
Oh, so it's working, but the light's off.
Okay.
Is that? And thank you for joining us today for the meeting of the New York City Health and Hospitals Audit Committee. Today's meeting is officially called to order. Pursuant to bylaw section 14 on committee attendance, if any member of a standing or special committee of the board will not be present at a scheduled committee meeting, the member may ask the chair of the board to request that another board member, not a member of that committee, attend the scheduled meeting and be counted as a member for purposes of quorum and voting. Therefore, Jose Pagan has authorized Ann Williams Isom, represented by Aaron Kelly, to be counted for the purposes of quorum and voting on his behalf. Okay. First item is a motion to adopt the minutes of the Audit Committee meeting held on July 16, 2024. Could I have a second, please?
Second.
Okay, Dr. Katz, vote.
Yes.
Frida Wong?
Yes.
Aaron Kelly?
Yes.
Okay, the motion's adopted. I'd like to now propose a motion to convene an executive session to discuss confidential and privileged matters that may be related to threatened and potential litigation. Second?
Second.
Okay. A vote, Dr. Katz?
Yes.
Frida Wong?
Yes.
Aaron Kelly?
Yes.
All right, thank you, everyone. I ask that only those specifically invited proceed to the adjacent conference room.
Are we going there or are they? We're going there. Okay, we're going there.
Okay. Do I need to say what we discussed at executive? Okay. um, Finish this. Next on the agenda will be the presentation of the KPMG fiscal year 2024 report by Maria Tiso.
Good? Okay, great. Good morning, everybody. Thank you. So we're here today to go through our required communications and audit results of the corporation's audit as of June 30th, 2024. I'm going to start out by introducing my team. Camille Fremont. To my right is one of my supporting partners. To her right is Ryan Santanacita, Managing Director, and to his right is Yimiao Chen, who's the Senior Manager on the account. So before I begin, I wanted to thank, John, Dave, and James, and the rest of the management team for all the hard work that was put during the audit process. As you know, it's the first year that we were the auditors in this contract cycle. So we started in July, and I think we achieved a lot since July to get to this point in time. So I just wanted to extend my thanks to the entire management team to working with us to get to this point. So thank you. So moving to delivering a better audit experience. So this slide, which you'll probably see going forward, discusses how we provide an exceptional client experience, and we try to do that in 4 ways. First, our first priority is to make sure that we're providing a quality audit in accordance with the standards. Second, making sure that the engagement team members that are assigned to the audit have both the necessary Governmental Accounting Standards Board and healthcare experience to work on the account. Third, making sure that the audit is efficient and effective and continue to use technology tools, which I'll talk about in a minute. And then lastly, continue to provide management and the committee with industry insights. We'll bring Ash Yata, our National Healthcare Industry Lead, to some of the meetings to talk about what's going on in the industry. So more to come on that. The next slide talks about expanding the use of audit technology. So our audit uses technology so that we can make the audit more efficient and effective. So we have 4 columns here, so I'll just quickly go through them. Under the column for analytics, these tools help us, go through large volumes of data to identify any patterns or trends that we need to focus on. In the past, we used to do a sample selection of like 25, but now these tools help us look at a large data set, which gives us more insight of what's really going on in the population. The next column is automation. These tools help us with some of the time-consuming audit tasks, so we can focus on more of the significant areas. And then collaboration and workflow. Our audit documentation tool is called KPMG Clara, which helps us kind of pinpoint the status of the audit at all times. So we work with management as it relates to the collaboration and then the workflow documentation throughout the year. The next slide was put in as of October 16th. So these were the open items at that point in time, because I know this presentation had to be sent out earlier than this meeting. So all these items have been received. The only thing that we need to do in order to issue the audit report today is the last one, is to receive the management representation letter, which we plan to receive from management today so we can issue our report. But all these items have been completed and received and documented in our work papers. The next slide are audit deliverables. We have it broken out into 2 sections. The current deliverables that we'll be issuing today, which is the auditor's report on the corporation's financial statement as of June 30th, 2024. In that report, we have a report on internal controls over financial reporting and on compliance and other matters. So that opinion will be issued today in that financial statement. And then lastly, we'll be issuing a debt compliance letter, which indicates that the corporation has met its compliance requirements with their outstanding bonds. And then below that are some future deliverables. We'll be coming back to the committee in December to present the management letter. We'll be completing the audit of the HHC ACO, which will be issued in December. And then next year in March of 2025, we'll be issuing the Metro Plus Health Plan audit, the HHC Insurance Company audit, and then there's various regulatory cost reports that we'll be working on with management. Okay, moving to the next 2 slides. These are a summary of our required communications and other matters. I'm not going to go through everything. I'll just highlight some of the key points. Corrected audit misstatements, so there were 2 corrected audit misstatements to the opening net position balance. So as we were performing our opening balance test work, which we're required to do because we're the new auditors, we noted that the OPEB and pension liability for deferred inflows of resources were overstated by about $321 million. And really, this was a result of the cumulative result of changes from the actuarial valuations in the prior years. So because those adjustments were above our materiality threshold, the opening balance was restated. And that's why we have a single-year financial statement, because we did not audit the prior year. And so we had to go with the single audit presentation. And we worked with management throughout that process. And we'll talk a little bit more about that. As it relates to the auditor's report, so we're planning on issuing an unqualified opinion, which is the highest level of assurance that the financial statements are free of material misstatement. In that opinion, there is an other matters paragraph that talks to the fact that the opening balance was restated. Okay, so that's just clarification in there, so a reader can look at it and see why. And then, as it relates to a material weakness and internal control, again, this goes back to the fact that because that adjustment was material and there was a restatement in accordance with the standards, we had to have a finding and it was denoted as a material weakness. We can go through that, but that finding has been remediated because the adjustment has been recorded. Okay. And then as it relates to the, no significant difficulties encountered during the audit, we received full cooperation from the management team and access to all documents and records. And we're not aware of management consulting with any other accountants as it relates to any items that we were discussing during the audit. Turning to the next page, there was one new GASB standard that was adopted in the current year. It's called GASB Statement Number 100, Accounting Changes and Error Corrections. That is effective for periods ending after June 15, 2023. So that was adopted in the current year. There were no significant changes to our initial 2024 audit plan, which we came to the committee on July 16th, so there were no changes to that. And as it relates to consultation, we did have various consultations with our national office. There was one legal matter that we discussed, which we needed to document in our work papers. We did have extensive conversation with them as it relates to the restatement because we had to work through our national office as it relates to presentation. And then we also consulted with them to confirm the discrete presentation of Metro Plus Health Plan. So that was all resolved. There were no actual or suspected fraud involving management's employees, as well as except for one matter that we discussed with management, we're not aware of any matters that need to be communicated to the committee as it relates to noncompliance with laws and regulations. And it relates to independence. We are independent as it relates to New York City Health and Hospital Corporation. So at this moment, I'm going to turn it over to Ryan, who's just going to shed some color on the 2 corrected audit misstatements. He'll walk through, and he'll walk through the material weakness finding as well.
Thanks, Maria. And as Maria previously mentioned, as part of our opening balance sheet test work and our initial current year risk assessment procedures, we obtained the prior year actuarial reports for the pension and OPEB liabilities, and as part of that process, we reconciled them to the prior year financial statements. And we had identified certain variances. We did obtain an understanding of the background for each of the variances as well as the root cause. So as Maria noted, the aggregate adjustment was approximately $324 million. The first adjustment, which had related specifically to the deferred inflow of resources for pension, was approximately $212 million, and the difference for the deferred inflow of resources related to OPEB was approximately $111 million. Again, as noted, these differences were a result of errors or issues in the prior year that were identified and treated in a particular way. Management has been proactive in working with the New York City's Office of the Actuary to resolve and identify these matters, and these 2 adjustments were corrected in the opening net position. Moving on to page 12.
Sorry, Sally, may I?
Yes.
So just to clarify, those adjustments result in a positive adjustment?
Yes. So it reduced your net position. So it was a positive adjustment.
Positive adjustment.
Yep.
And they were due to actuarial?
Changes in actuarial calculations exactly,
from
yep.
the city's actuary.
From the city's actuary, exactly.
Thank you.
As noted, as of June 30, 23, the opening net, or the net position was restated due to the two corrected adjustments noted on the prior page. Again, as Maria previously hit on, it was a single-year financial statement due to the adoption of GASB 100. And again, she had previously noted that there would be an other matter paragraph included in our opinion, again, which just states that there were two audit adjustments that were set to restate the unrestricted net position, and that the previously issued financial statements were audited by other auditors. Moving on to slide 13, which is again the material weakness. We had noted that the controls over the pension and OPEB deferred inflows were not properly designed, or were not properly designed to meet the intended level of precision. Again, as noted, the slides, on the prior slides, it was a cumulative effect of approximately 324 million, and management corrected these by restating the net position as of 6/30/23.
Great. Okay. With that, we're going to turn it over to Camille to go through some of the accounting estimates, some of the procedures that we performed, and some of the conclusions on them.
Great. Good morning, everyone. Thank you for having us with you today. The first area we're going to talk about is your valuation of patient accounts receivable. This is one of the largest estimates that are within the financial statements, and an area that management spends time making sure is reasonable. So management takes into account the impacts of contractual agreements with third parties, their historical collection rates, and then current economic trends when coming up with an estimate for this balance. What we do as a result of that is we perform an independent look-back analysis utilizing one of our data and analytic tools, so how we're embedding technology throughout the audit, and we look at your prior year patient accounts receivable balance to see how well management was at estimating that amount. And as we did that, we determined management's ability to estimate that number was reasonable. But then we need to think about how are we going to approach our expectations of the June 30, 2024 patient accounts receivable, knowing that Change Healthcare happened, right? And prior historical collection rates were going to be impacted by the slowdown in the ability to collect cash because of what was going on at Change Healthcare. So what we did is we looked at your subsequent cash collections from July 1st, 2024 through September 30th, 2024. And then we also looked at those historical collection patterns that had happened on the June 30th, 2023, took all that information into account and developed our own waterfall analysis that we compared to what management was anticipating happening. And as a reminder, Change Healthcare happened in February of 24, right? So as we're going through, management is working through the additional posting of cash and the processing of claims. And ultimately, we were able to come to a determination that management's estimate as of June 30, 2024 was reasonable in relation to the financial statements taken as a whole, and management continues to apply the cash that they are receiving to the various patient accounts receivable. So turning the slide, the next area of estimation within the financial statements is your valuation of the pension obligation as well as your other post-employment obligations. So management at New York City Health and Hospitals maintains a census data of participants that are eligible into the plan, and they give that information to the New York City Office of the Actuary, who ultimately gives back to management two different reports. They get a valuation report of the net position on the liability, and then they also get an OPEB, or an other post-retirement benefit liability report, from the City of New York's actuary. We then take those reports and we share them with our own actuary to go through and evaluate the methods and assumptions that are used for reasonableness and consistency with the requirements of the various GASB pronouncements. And then we also do test work over the underlying census data, because that census data forms the basis for the calculation, and we need to make sure that that is complete and accurate. As a result of all of our test work that we did, we determined that the valuation of GASB 68 and GASB 75 for both pension and OPEB and the related disclosures were reasonable and appropriate in relation to the financial statements taken as a whole. And then,
Quick question on the OPEB and the pension liabilities.
Yes.
You said the amount kind of triggered a finding of materiality. We have no assurances that there might not be some other correction going forward. Is it helpful to get a sense of what triggers what kind of finding? If it's 200 million next year or 20 million, we have no way of knowing if there's going to be an issue.
Yeah.
How do we deal with that going forward?
So maybe the first step is management will continue to book to the actuarial report, which is their best information at the time. And then to your point, there are certain things that are considered change in estimates. So items that could not have been known as of your balance sheet date that will flow through the following year. And then unfortunately, there could be issues that should have been known at the time of the balance sheet date that come to light subsequently. So every year when we look at your financial statements, we make an assessment of materiality, thinking through what users of the financial statements would find relevant to them, what the standard would say that you should be within a certain range. The best process that management can do and that they're doing is book to the actuarial report. And so there's no guarantees that they can't find something in the future, to your point. So we can't give you a dollar amount.
Yeah, so Sally, materiality is based on quantitative information and qualitative, that could change every year based on the results of the organization. So, you know, so one of the things that we did tell management is to make sure that they're booking to the actuarial valuation, but also make sure that they're having, you know, communications with the Office of the Actuary periodically also, to make sure that there's nothing happening during the year.
There's a quantitative and a qualitative.
Correct, right, it's both, exactly. So it's not just like, hey, this is the one number and that's it. So
Right.
there's different factors that go into it.
Thank you.
Okay.
So the final estimate that we want to talk about within the financial statements is the valuations of claims payable for incurred but not reported claims for Metro Plus or IBNR. So throughout the process, management gets a third-party actuary to calculate that liability based on historical paid claims data, and ultimately books that actuarial report and takes into account other liabilities the plan may have. We use a KPMG actuary to come up with an independent estimate using the same paid claims data, and then similar to patient accounts receivable, perform a look-back analysis on the historical IBNR reserves. We also perform test work over that paid claims data and membership data that's utilized in the actuary, for which our actuary then takes into account when they're coming up with their independent estimate. We were able to determine that the valuation of claims payable for that incurred but not reported claims liability was reasonable in relation to the financial statements taken as a whole. At this point, as we turn the slide, I would just ask all the members of the committee to just take a moment and read the questions on the slide. If there are any items, we can always discuss that at a different point in time.
Right. And then lastly, we had added some information in the appendix, just items to consider, you know, on the 2024 board agenda, positioning audit committees for the future. These are some of the issues that we see nationally. Again, as you go through it, if you have any questions, you can directly reach out to me, and then I can have a separate conversation with you on that.
Okay.
Okay. But at this point, that concludes our presentation. If there are any further questions, we'll take them now.
Are there any questions? Okay. Do we need a motion? Oh, we just got nothing. Okay. All right, then we'll move on to a presentation of the fiscal year 2024 draft financial statement by David Guzman and James Linhart.
Good morning. So today we will be presenting the 2024 financial statements for the Health and Hospitals Corporation. Before I present the financial statements to the Audit Committee, I want to take the time out to thank the Controller's Office staff, some of whom are here with me today, many of our colleagues throughout the system, our corporate finance folks in other areas that are contributors to these financial statements, and also KPMG, our partners, for their tireless work in helping us, collaborating with us to get the financial statements to the point that they are for presentation. Today we'll focus on a statement of revenues, expenses, and changes in net position. also known as the income statement, which encapsulates the system's overall financial performance for fiscal year 24. So in fiscal year 24, the income statement is showing total operating revenue of $15.9 billion and a total operating expense of $15.2 billion, with an operating gain of $623 million. Controlling for capital contributions, there was an improvement in net position of $1.1 billion on the bottom line. Some of the key trends and drivers for this performance, I'll summarize as follows. So revenue increased by $1.9 billion. Net patient service revenue in particular increased by $115.9 million overall. That was due to patient service revenue increases, particularly around inpatient, outpatient SNF collections, Metro Plus risk pool, and non-Metro Plus risk pool increases. We also noted an increase in discharges of 3,467. And we also noted significant increases in NPSR eliminations between Metro Plus and H&H to the tune of $303.5 million, which seems to be indicative of greater business between the two entities. Appropriations from the City of New York increased $1.2 billion. That increase was driven by support for our HERC program and some support for collectively bargained increases, mainly around 1180, OSA, DC 37, and other various trade locals. Premium revenue increased by $166.7 million, driven by provider investment funding associated with the Essentials Plan, favorable premiums including New York City H&H UPL, safety net hospital directed payments, financially distressed hospital add-on funding, and higher supplemental maternity and newborn kick premiums. Grant revenue increased by $414.7 million. This was driven by recognition of COVID FEMA revenue, about $356 million in that area. Behavioral Health Centers of Excellence funding, $41.3 million, and HERC grant funding, overall $201 million, 96.3 federal, 104.9 state. Overall revenue other revenue decreased by $37.3 million, mainly due to reductions in 340B pharmacy program revenue. And there were also various one-time payments that were received in 23 that did not recur in fiscal year 24. Turning to expenses, there was an increase also of $1.3 billion. PS expense increased by $401.6 million due to collective bargaining settlements and increases in FTEs. So we noted an increase of approximately 3,661 FTEs on the H&H payroll system. I think that highlights the great work around transitioning from temp nurses to kind of, H&H staff. So we're very happy about that. OTPS increased by $569 million due to increases in HERC OTPS. Fringe benefits increased by $55.9 million, mainly due to increases in health benefit rates. And the increase in FTEs as well is bringing about an increase in that area. Pension and OPEB increased by $51 million and $68 million respectively due to changes in actuarial calculations as calculated by the New York City Office of the Actuary. Affiliation expense increased by $137 million due to contractual increases and estimated contract settlements. Depreciation increased by $34.8 million, mainly as a result of the opening of the South Brooklyn Health Facility and EITS capital transfers of $14.5 million. Other changes in net position decreased by $115.7 million. So we noted a capital contributions funded by the City of New York decreased by $120.5 million due to a decrease in construction in progress for a capital project at Bellevue, and also some changes to CIP associated with network refresh and data center projects for EITS. There was also, in terms of capital contributions funded by grants and donors, that was actually relatively constant with a minor year-over-year increase of $4.8 million. So as previously mentioned, there is an operating gain of $623 million and an improvement of $1.1 billion to the corporation's net deficit position. So we ended the year at a negative 309 million in net deficit position, which is, I think, is pretty good. Good results.
Yeah, I think we agree. So,
Your questions?
well, thank you, and also, thank you, KPMG. I didn't thank you before for the terrific collaborative work that you did this year. I know you came on new, and there was ramp-up time, but you clearly jumped in and produced a wonderful product, so thank you.
Thank you so much.
No, just to echo Sally's comments, both to certainly the finance team and the controller's office and KPMG as well. Great collaboration came through in the presentation and the dialogue, and clearly the results are in the right direction, even on a consolidated basis, having a net positive.
Thank you.
Thank you.
Okay. All right.
Oh, mm.
I would,
Just reminding you to turn on your light
Oh,
if you're
sorry.
speaking.
yeah. I'd like to propose a motion to accept the fiscal year 2024 financial statements as presented. May I have a second?
Second,
Okay. On the vote, Dr. Katz?
yes.
Frida Wong?
Yes.
Erin Kelly? Yes. Okay, motion's adopted. Next, we'll have an audit update from Devon Wilson. Devon?
Okay, thanks, Sally. Good morning, everyone. Devin Wilson, Senior Director of Internal Audits, and I'm filling in today for Joel Keith. All right. Okay, so we're going to start with the external audits. Currently, we have 3 external audits going on. 2 is from the New York City Controller's Office, and 1 is from the State Controller's Office. The first one is the audit of Department of Correctional efforts to ensure access to mental health services for inmates. So we are coordinating this with Patsy Yang from Correctional Health and the Mayor's Office, Office of Community Mental Health. So this is ongoing, and hopefully they can come up with some, recommendation or findings. But at this point, we don't know exactly when this is going to be concluded. So this is ongoing at this point. The second one is audit of language access, and this is from the State Controller's Office. So we're working closely with the diversity and inclusion team at central office here. So basically, how this one is going, we have gone to different facilities, and they want to make sure that the language access is displayed throughout the facilities. So that's basically what they're doing, is to make sure that, when the patient comes in, they know exactly what language is offered. So this one again is ongoing, and we're not sure exactly when this is going to be concluded. The third,
I'm sorry, to the extent that there have been visits as part of this audit, there's been no feedback to us on any issues being found.
not at this point. So basically, we kind of shadow them when they're going to the facilities to make sure that they ask the right question and they don't go out of scope. So based on what we have seen, Sally, is that they're observing, to make sure that we have signage for the different language at the facilities. So we haven't gotten any feedback from them as yet. The third one, as I mentioned, this one is from the New York City Controller's Office, and this one is Audit of Behavioral Health, Emergency Assistance Response Division, and New York City Police Department. And this one started back in August of 2023, and we had a meeting with them, and we provide them with the documentation that they requested, and we haven't gotten any feedback from them as yet. So all 3 external auditors are in progress and ongoing. The number of audits for FY 2025, so far 0 completed. We have 2 in progress, and we have 3 that is not started. All right, and the next slide, we'll talk about the auxiliaries. And probably the next meeting or so, we won't have any auxiliary audits to update on. we made a management decision where all the auxiliaries are going to employ their own independent CPA firm to do this work. So we're in the process of winding down with the Bonadio group. So probably the next committee or so, all of this should be completed. And what that means is that each auxiliary will employ their own auditor, and they would be responsible for that fee going forward.
Some auxiliaries chose to dissolve themselves.
Yes, so that's with Deb Brown's group. So they're working to dissolve because from a cost benefit relationship, it doesn't make a lot of sense, Sally, because the revenue that they're bringing in is very small, and those, like for example, say Seaview, they just don't have enough to proceed. So those they're going to be dissolving.
Okay,
And
thank
then
you.
the others now will, we spoke to Deb Brown's team, and if they want to maintain the Bonadio group, they can do that, but we're not going to be involved.
Right, okay, thank you, David.
All right. Okay, so that concludes my presentation. Any questions? Okay.
Okay, thank you very much, Devin.
Okay.
And next, we'll have a compliance update from Catherine Patzos.
Good morning, everyone. Catherine Patzos, Chief Corporate Compliance Officer. If we could move on to the next slide. So we're going over some of the activities from the Office of Corporate Compliance. As we have done through last year, are working with internal audits to prepare a combined 2026 risk assessment. I have met with Joe O'Keefe and senior leadership to discuss some of their goals and objectives and obstacles to achieving them, and any risks that they foresee in their functional areas. We anticipate that these meetings will continue until early November. They are nearly complete as of this time. In addition, the compliance and privacy officers and one of the auditors from internal audits are sending the questions that we've been presenting to senior leadership to their facilities, CEOs, CFOs, and HIM directors to get their input on the similar topics. With coal fire, they are winding down their 2024 HIPAA risk analysis. They have completed all the interviews, data collection, site visits for the year, and the risk and compliance workbooks and reports for the GNTCs and neighborhood health centers and skilled nursing facilities have also been completed. And all that really is left is for the compliance and risk workbooks and reports for the enterprise and acute care facilities, which all of those should be completed by the end of this month. And as coal fire's contract is ending at the end of this year, we have issued an RFP to continue these services for us. That was posted to the city register in June and sent to existing known vendors in this space. We received 3 proposals in response to the RFP. 2 of them were asked to make presentations, which occurred on September 13th, 2024. The evaluation committee scored the 2 vendors very closely. However, one of them did score just slightly higher than the other. We did present this morning to the contract review committee, which approved the application to enter into a contract. We will then present it to this committee and to the board of directors in December for approval. The contract will be for 3 years with 2 one-year renewals at our option. Budget for the 5 years is $7 million. The pre-contract value is approximately $4 million for 3 years, and we add an annual baseline 5% inflator for this particular contract. Any
So
questions on
Catherine,
this?
how long have we been working with coal
6
fire?
years.
6 years, and then this would be an additional 3 to 5
3
years.
to 5 years, correct.
Okay, thank you. Any questions?
Just so the 2026 risk assessment you talked about, does coal fire work with you on?
No, that's an enterprise kind of a risk assessment to evaluate the risks, the legal, compliance, regulatory, reputational, and operational risks to the enterprise that we work with internal audits on. The coal fire really is focused only on the HIPAA risk
I
analysis.
see, got it. And then, so on the FY 26 risk assessment, that would take like cyber things and all of that is.
We do consider that in this. It is to the extent that it is not included in the coal fire risk assessment, because as there are going to be, which we actually might include in the next iteration of the next contract, are the state cybersecurity regulations for hospitals, which might actually be part of the next contract for the HIPAA risk analysis, because it really is kind of very closely aligned to that type of evaluations that the vendor will be doing.
Right. So, on the 26 risk assessment, once you get through the steps that you described, do you present that to the?
We present that to the, we present the risk and assessment to the Enterprise Risk and Compliance Committee, and they discuss those risks, determine which ones, I'll like to the level of including them in the work plan, the fiscal year work plan, which is brought to this committee for approval.
Right. And this, I guess, is the second year that Catherine and Joe,
Have been working together.
compliance and audit,
Collaborated, yes.
were collaborating, which I think is a terrific idea.
Yeah, I agree. I just, it occurred to me somewhere with, given Change Healthcare and all the things that have been happening, we talked about some of these risks and trying to see where that gets captured. But it would really be.
It would get captured in one or the other, depending on where it hits the subject area that it falls under. If it's closely aligned to our electronic health information, or is it broader to the extent that, I mean, that it might impact other areas?
So does Kim and her team get involved?
Yes.
Yeah.
Absolutely. Next one is the Policy and Resource Hub, which we've been working on with the data and analytics team for quite some time now. We have, it does house all of our operating procedures, and it's designed to be the location for all types of resource documents. So, for example, policies, guides, tip sheets, etc. It is now live on the intranet, and so all the policies are searchable, and we'll be able to use the tool to update all the operating procedures, as well as any other resources that, as they start being uploaded to the tool. We will be meeting with the operating procedure owners, co-owners, and collaborators. Collaborators being those other senior leadership individuals who would need to provide input to the operating procedures. And we're going to demonstrating the tool for them so that everyone knows how to use it, and we can start actually putting it into play. And then the next phase after, once that is done, is to present it to other CEOs and system leadership. I'm very excited about this.
This is very exciting.
Excited about this tool.
To have them all housed in one place is true.
Yes. We are coming up on the Corporate Compliance and Ethics Week, which is the first week in November. The compliance and privacy officers will have tables set up at their various facilities and at central office locations to promote compliance and ethical behavior. They will have games and giveaways and prizes at the tables. There will also be 2 sets of webinars, one on fraud, waste, and abuse, and one on HIPAA compliance. Workforce members are able to enter into a drawing for a grand prize if they either attend a webinar, complete a compliance quiz with 100%, or successfully resolve the puzzles, and complete both of their compliance and their HIPAA trainings for the year. And we are also going to be promoting our compliance workforce member survey to increase the completion rate this year over the past year. So there will be a QR code at the tables where that workforce members can scan in. So hopefully that will increase the participation in this compliance survey. Next is the KPMG billing and coding compliance reviews. They are working on prospective review of short stay inpatient admissions and behavioral health services, and will soon start on review of telehealth services. They are also going to assist in developing and formalizing a coding compliance program, and will recommend areas and topics for training and education that will be based on their findings from the audits that they have completed already. They will also assist the Office of Corporate Compliance in remediating some of the items on the fiscal 2025 corporate compliance work plan that were related to billing and coding and medical record documentation completeness. Any questions on that? The next item is our special needs model care trainings. Centers for Medicare and Medicaid Services require that all of the special needs plan providers complete this model of care training every year for each of the managed care plans in which they participate. We have to attest to each managed care plan that our providers are enrolled in their plans. Providers who are enrolled in their plans have completed their trainings. So in September, we sent an email to the providers with a link to each of these SNP mock trainings, which have to be completed by the end of the year. Briefly on some new regulatory requirements out of Health and Human Services. One regarding the 42 CFR Part 2 substance use disorder regulations. There's some revisions to that, as well as the Office for Civil Rights publishing a final rulemaking on reproductive health care privacy. We are working to develop a plan on how to comply with each of these rules, which will include changes to our notice of privacy practices, our treatment payment healthcare operations, as well as some of our HIPAA compliance and HIPAA privacy operating procedures. There's also a requirement for an attestation to be completed by certain requesters of reproductive health records, and the attestation requires them to assure that there's the requested use of disclosure is not for a prohibited purpose, being one of those 3 enumerated purposes listed there. And just some metrics, we are on the compliance, we are steady throughout the first three quarters of this year. And in the next slide, the privacy reports fortunately have decreased this year over the quarter over quarter. And finally, these are the issue types, with personal privacy being the most reported one, and with patient care, patient rights, and misconduct following. That concludes my report.
Any questions?
Karen, do you have any, obviously 22 to 23 was a great trend on the compliance report metrics, and we're going up again. Do you attribute that to any?
Well, there's a good thing and a bad thing about the compliance reports. We want people to report.
Okay.
That's the good thing. We don't want a lot of non-compliance, but we do want people to report. Also, because the Office of Medicaid Inspector General requires us to publicize our helpline so for Medicaid recipients. So we do get some reports from individuals, mostly on patient care, patient rights issues.
Okay, no other questions. Any old business or new business to come before the committee? If there's no further discussion, the meeting's adjourned. Thank you.
Thank you. This meeting is no longer being recorded.